all the physicians at the same time in front of the patient rather than the patient going from room to room. So this is the model that we are following, and we have had very encouraging responses. We run courses, MD Manasa Rog. We run PhD in integrative medicine, postdoctoral fellowship in integrative psychiatry for students, postgraduate MD psychiatry students, and uh, postdoctoral fellowship for in integrative mental health and neurosciences, that is for MD Ayurveda students. Then MSc Yoga. So five courses we are running, and we are in terms of research, we have embarked on an endeavor of generating evidence on the mechanisms of action of Ayurveda and yoga by conducting systematic studies and publishing it. We are a center of excellence for in Ayush research by the Ministry of Ayush. So yeah, this is about the department, and very recently Ministry of Ayush has been very closely working with us, supporting us in all our endeavors, especially in mental health. And also they gave the idea of conducting a month-long awareness program on this. And we could not find any better person than Shri Krishna Kandelji. I should thank Dr. Umesh, who met Khandel sir during one of his conference visits to Delhi, and then also talked about what we are doing here, and he readily agreed that time that he will be more than happy to associate with us, guide us in our endeavors. So that is one incident. And the second incident, and the second thing I would like to say is he is among very few stalwarts or luminaries of Ayurveda, who's now there and actively in the field. Many of his contemporaries are not there active. And that is a fortunate for all of us to have him with us. And he he has a very specific penchant for mental health. Although there is no field that he has not touched upon. This is another matter. But then in mental health, it is very interesting insights that sir has. And apart from that, he is a very profound scholar of Sanskrit, with all the classics in his fingertips. So his ability to synthesize ancient thoughts and merge it with the modern outlook and modern insight is extremely rare and one of its kind. So I am very happy to welcome you to this guest lecture, sir, with also hope that you will visit Nimhans and bless us on whatever we are doing here. So I would now, yeah, with this welcome of Khandel, sir. Apart from that, we have the students from our certificate courses, like certificate course in Indian medicine, in integrative medicine, certificate course in mental health. They have joined us. We also have students, staff, and admirers of Ayurveda from various fields of mental, from various domains, working in the field of mental health, like psychologists, psychiatrists, and students, and so on, professionals. So I welcome all of you on behalf of the director Nimhans and administration Nimhans for joining us in this guest lecture. I hope we will have a very interesting intellectual retreat. So I hand over the mic to Dr. Kavya to introduce sir quickly, so that we can listen to him as soon as possible. Thank you, sir. Thank you very
Thank
much.
you.
Thank you, sir. Now I request Dr. Umesh, Assistant Professor, Department of Integrative Medicine, to introduce our today's speaker.
Namaste, sir. And I'm very fortunate to introduce, as rightly said by Kishore sir, the living stalwart in the field of Ayurveda. So, if you want to introduce, there are volumes to tell about, sir, but I think it's not possible to concise all those things. I have tried my best. A brief top of brief I have derived. So, without much of our people are waiting, for the whole gathering is there is eagerly to waiting to listen, sir. So, briefly, I would to like to introduce, sir. Sri Krishna Kandel sir is a rich, like he has a more than 40 years of his journey in global Ayurveda, and he is a seasoned consultant physician, academician, mentor, author, researcher, and a counselor. So he has a double gold medalist status in both undergraduate and postgraduate Ayurvedic studies. And coming to the professional roles, I am just highlighting a very few of them. So he has worked as he is the for former professor at National Institute of Ayurveda, Jaipur. He has served as chairman, Institution Ethics Committee. He is serving as at All India Institute of Ayurveda in Delhi. He is the chairman, Scientific Advisory Groups at CCRS. He is a natural teacher, national teacher at RAV. He is a national teacher at CCRS. He was a distinguished faculty at IMS BHU. He was governor's nominee at Kurukshetra Ayurveda University, and he holds roles as a visiting physician and Ayurveda teacher in health centers in Germany and USA. And he has significantly contributed to the St. Vincent Psychiatric Department, Melbourne, Australia. And few of his academic things, he has guided and several MD and PhD students, delivered over 400 extensive hours of lectures, guest speeches, and keynotes. He has published more than 57 research papers in various national and international journals, and is a senior editor for international version of Charaka Samhita. So, with this a small introduction, now I request Sri Krishna Kandel sir to take over the session.
Thank
Thank
you,
you.
sir. Thank you, sir. So today, now we'll be starting the session. I request Dr. Sri Krishna Khandel, sir, to kindly proceed with the session. We are eager to listen to you, sir.
Okay, thank you. Thank you, National Institute of Mental Health and Neurosciences, Bangalore. And on behalf of that, Professor Kishore and Professor Umesh. And I am very much grateful to congratulate you to organize this type of the lecture on the International Mental Health Day. Thank you very much. I start my lecture without any reference. Actually, what I am doing, I will tell you in a very brief. And I am not in practice of the making some PowerPoints or something. So I will talk abruptly on lecture. You said that your faculty, apart from the Ayurveda, is also joining this session. So this may be some difficult word for them, but every Indian should know what we are having about the mental health. Definitely, I am sure they will be benefited with these deliberations. Thank you very much. First of all, I am thankful to Mala Kapadia also. She joined at very short notice and she is working in the field of mental health very sincerely, and she organized one international seminar in Coimbatore recently. I was not there, unfortunately. I was out of country that time, but now I will join you and Malaji shortly. Definitely. One basic difference between the Ayurvedic Manasarog and modern psychiatry is the psychology, philosophy-based psychology, and darshan-based psychology. What is the difference between philosophy and darshan? philosophy is the hypothesis, and darshan what have been seen by the seers. Our rishis seen that philosophy and in by dhyan chakshu, gyan chakshu, or tapas chakshu. These were the tools of the darshan. But chakshu was there, eye was there. So there is a big difference between the philosophy and darshan. And darshan, when we see the things in eye views, then it converts into the matter. Hypothesis is just fantasy. But when we see the things, then it converts into the matter, dravya. Dravya means manas is also dravya in Ayurveda, matter. Dravyasritam karma yaduchyate kriyeti. How the manas or mana works, because it is dravya, it is adhyatma dravya guna sangraha. Mana manorath buddhi atma cheti adhyatma dravya guna sangraha. It is written in Charak Sutra 8 by 13. And Subha Subha Pravritti Nivritti Hetu. It is the cause of good and bad deeds. So it is dravya. And how it is dravya? There are 3 sections of the manas are described there in same chapter. That is manah, sattvam, chetah ityahureke. One part of manas rog is mana. Second part is very important, that is dravya, purely dravya, that is sattva. And third one is outcome of this dravya, that is chetas. So what is mana? Mana is the governor, mana is operator, mana is operators of this apparatus. Basically, what we are seeing, this whole body is mind. This is the illusion that we are having body. This whole body is mind according to the Ayurveda. Every cell is the apparatus of that mana. And that cell also has its own mind. So we are having the mind through the toe of to top. Everything is dravya, everything has mind, everything has sensation, everything has sukh and dukh. So everything has its own mind. First thing. Then mana is indriya vigraha karma manasa swasya nagraha. And what is the symptom of mana? Lakshanam manaso jnanasya abhavo bhava evacha. Symptom of mana is getting knowledge or absence of the knowledge. Abhav and bhav of the knowledge is symptom of the mana. How this gets the knowledge? Indriya vigraha. It gathers the information, a full-scope information gathered from the indriya or sensory system, that is gathered by the mana for procession into the knowledge. What is that? 5 processes are there: chintya, vicharya, oya, dheya, and sankalpa. What is chintya? Many good or bad, very useful or harmful, many information indriya takes every time, even in sleeping time also. What is useful for consideration? That is chintya. And rest are achintya. These are unconsiderable. very few of them are to be focused by the manas. And that is to be analyzed, that is useful, now useful, or later useful, considerable now or after that, or it is harmful or useful. This is uha. Then dheya, amalgamation of the considerable things, analyzed things into the emotions. Dheyam bhavana jnana vishayam. That now become goal or the knowledge. That become now dheya or goal or purpose. So dheya is the fourth stage. And then conviction, then sankalpa, nirvikalpak gyan. Nirvikalpak, no substitute of this particular thing. We have to know this thing very well. Then tatah param buddhi pravartate. Uho vicharasya tatah param buddhi pravartate. After these five stages, after converting into the sankalpa or conviction, the man delivers it to the wisdom or intellect for nishchay and vyavasaya. Nishchay means confirmation, or vyavasaya means execution. The buddhi is the instrument who does confirmation and do how to respond, how to execute, but with the help of patience, with the help of dhriti bransa, niyam and nished, niyam and vidhi and nished. What is to be done, what is not to be done, what is the rule, what is overruled, this time what is the discipline, at what age, at what time, at what personality, and what mental status of the response is there. So this is decided by the dhriti or dharya. And then smriti. This smriti has a lot of memories of previous deeds. Then when we did this job, what was the result? This person is not reliable or believable or reliable or thinkable or not thinkable, this doable or not doable. This is in your memory, and every cell has its own memory. So the dhriti and smriti, these are combinedly known as pragya. So first indriya, then manas, then pragya. This is the process of the knowledge. Ultimately, this knowledge is converted into the truth. After scrutinizing what was the false. Sat, truth. This Sat is Chetas, Sat is truth, Sat is knowledge. The whole information has a very little truth, and false information are to be deleted immediately from the memory, because smartavyam hi smartau sthitam. What is rememberable, that only should retain in the memory, and what is forgettable, that should be deleted immediately from the memory. This is written in Charak Sari 1. So Smriti will tell you Smrtva Swabhavam Bhavanam Sarva Dukkha Vyapohaka. Smriti will tell you what is the Swabhav, what is his behavior is normal, because he is not yet developed as a human being. He is still behaving like animal. he is still behaving like many Pashu or Matsya or Asur or Rakshas or Sarp or Sakun. So, if the Swabhav of the person is known by the Smriti, okay, this is the basic principle of the knowledge. Okay, now we are coming to the Sattva. What is Sattva? This whole process is operated by the Manas. Lekin second part of the Manas is very important, and that is the nutritional source of the Manas. Because the Mana is Dravya, Mana is matter, and this matter is to be get nourished continuously. And what is this Sattva? There are 7 dhatu in body. After ahara ras, after good digestion and metabolism, we get anna ras, and that convert into rasa dhatu, rakta dhatu, mansa dhatu, and onward finally at sukra dhatu and ojas. Okay, this ojas is sattva. Sattva means essence of the all dhatus. This is the product of rasasar or rasadhatvoj, raktadhatvoj, mansadhatvoj, medodhatvoj, asthidhatvoj, majjadhatvoj, and sukradhatvoj. And finally, this is paroj or upper oj. Okay, these two factors are known as sattva. Yat sharir rasa sneha prana tatra pratisthita. The seat of life is not the tissue, not the organ, not the mind, not the atma even. The seat of the life is ojas or sattva. Yat sharir rasa sneha. This is written in Charak Sutristan 30. So, Sarir Rasa Sneha means essence of the essence. Rasasar is finally essence of the Rasa Dhatu. But all the 7 Dhatus essence is Sattvasar. And this Sattva is the nutrition for this mental cavity. And this is the switch between the body and mind. Sattvam aupapadukam yat jivam isprak sarirena saha abhisabadnati. Isprak sarir means this physical body. This physical body is connected with the mind with the help of switch of sattva, sattvam aupapadukam. This is the connection between the body and mind. Yasmin apagamana puruskriti. If this sattva is not performed very well, if sattva is not become very well, then silam asya vyavartate, code and conduct will be disturbed. Bhaktir viparyaste, liking and disliking will be altered. Vyadaya apyayante, manasik vyadaya, mental problems will be arised. And tasmat hina prananjahati, and this is the cause of deliberated suicides. Okay, so this sattva is very important. Sattva is the final product of the food. That's why in Upanishad, Chandogya Upanishad, one quote is there, Ahara Shuddhau Sattva Shuddhi, Sattva Shuddhau Dhruva Smriti. The best food, the pure food is where the sattva is the product of pure food. And the pure sattva is the basis for pure memory. Okay, ahara shuddhau, sattva shuddhau, dhruva smriti. One more quote is there from Chandogya Upanishad, ki tad aharam hi, this food will convert into 3 stages. First gross conversion is dosha, dhatu and mala. Gross conversion of food is in dosha, dhatu and mala. The middle conversion, second level conversion is ojas or sattva. And third one is mana. Anishtham mana. Anishtham mana. The atomic metabolic product is manas. Okay? This is written in Chandogya Upanishad. This means the every ion, every atom of the food is going into the sublimed stage, and finally sublimation is ojas or sattva, and that will nourish the mana. So this make our treatment procedures very easy. Otherwise, we are only dependent in philosophy, and philosophy cannot be a basis for the medical science. Philosophy can be a good basis of the psychology. Philosophy can be a good basis for the psychotherapies or counseling also. But philosophy for the purpose of the medicine or treatment, this is not the good basis. So that's why we have to understand what is the procedure of this gross matter converts into the subtle matter, and the subtlest matter is sattva. The subtlest form of the ahar is sattva, and that's why in Upanishad ahara shuddhi, and wonderfully you will wonder that Ayurveda in 4 chapters of one is a Vidhi chapter 24th of the Sutristan, one is Unmad, one is Apashmar, and in Apasmat Chikitsa there is one Atattva Bhinivesh. Ek eva mahagadaha Atattva Bhinivesha. All the mental problems are covered under one umbrella, that is Atattva Bhinivesh. And wonderfully, these all are caused by malin ahar. Malinahar Shilasya Rajo Moha Vritatmana. The same line, same causative list is written in Vidhi Shonitiya, in Unmad, in Apashmar, and in Atattva Bhinivesh. Means Malin Ahar. What is Malin Ahar? Malin ahar is full of the gross material only, that cannot go into the subtle matter. We can make the body from that malin ahar. 6 ap or 8 ap or something, muscle mass or fat mass or something, blood also, but not able to convert into the sar, not able to convert into the sattva. That's why malin ahar is the cause of all these 4 chapters. Malin ahar is the central point for all these mental problems. So malin ahar is very important. And you see, you are more knowledgeable from me that what is going on after COVID or before COVID. After COVID, 40-50% increase in the mental problems because of now the food adulterations, now the food habits change, now the migrated foods are in our practice, then we reheat, reuse, preserved food, ready to eat food. These are malin ahar. And this is the main cause for not converting the food into the subtle or atomic metabolization, that is sattva. That's why we are losing our confidence. We are very easily get angry, easily feared, easily stressed, easily go into the anxiety, easily go into the substance abuses. Our patience is loose, our memory is low, less, our intellect is, emotions are not pure even. So this is the reason. Ayurveda say this is the main reason for the mental problems. Now, this is the time when we are thinking about the causes. And most of the mental problems, we don't know the cause. We don't know the origin. We don't know the source causes. So this is the source cause of the all mental problems. You please take it and go through these chapters if you can. And few chapters from Upanishad, few chapters from Kanad Vaisheshik Darshan. Vaisheshik Darshan says, Mana eva manushyanam karanam manda mokshayo. Only this is the man which can bond or we bind the body and which can liberate the body. So what is the food for the liberation? Purity. The purity of the food is the basic treatment for the all mental problems. And unfortunately, all our psychiatric cases are unfortunately having this type of the malin ahar more than the normal people. And the parents are not in position to avoid this type of the habits or change this type of the habits of the patients also. This is the main problem. Then Avidhi Rakta. Avidhi Rakta means there are 3 more diseases are written in Avidhi Rakta. Mother, 6 types of the mother, 3 types of the murcha, and 3 types of the sannyas. Mother, Vatik mother, Paitik mother, Shleshmik mother, Raudhir mother, Vishaj mother, and Madhyaj mother. These are the 6 mothers. After substance abuses, the mind get intoxicated. And what is intoxicated really? That is blood intoxication. Intoxication through the blood going into the mind. So Vidhi Rakta and Avidhi Rakta. Vidhi Rakta means good blood and Avidhi Rakta is blood, intoxicated blood. And these are the causes for the intoxication of the blood. And that intoxicated blood, mind will not work properly. Shakta nalpa dhrutavasham chalaskalita chestim samprahara kalipriyam. And many of the symptoms are given there. They are fine, very beautifully define the mental problems. These are the primary stages of the mental problems. These are very primary mental problems, which are stress, anxiety, substance abuse, and fear, psychosis, and phobia, different type of the phobias. These are the mada. These mada means one is madatya, that is because of alcoholism. But mother is because of the blood impurities of the blood. That is written in chapter 24th of the Sutrishtha. So Mada, Murcha and Sanyas. And how these disease travels, what are the srotas for the disease? In commentary, the Gananath Sen has beautifully defined every mental problem is traveling through rasa astrig chetana vahi srotas. One common group of the srotas, that is rasava srotas, means what you say, the plasma, and blood is astring, and third one is life. This blood is jiva rakta. Susrut says raktam jiva iti sthiti. This is nothing, blood only. This is life dispensing system. Every living cell is floating in the blood. 1/3, 1/4 of the total cells are floating in the blood only. They are erythrocytes, leukocytes, or platelets. They are living cells. So, raktam jiva iti sthiti, blood is the only tissue which is floating the life within it. Yunakti praninam pranasonitam yanuvartate. Every cell of this body is connected with the life through the blood only. The blood is the dispenser of the life only. So that's why this chapter is very important. And every disease we confirm with the blood test only. Liver function, kidney functions, or lipid profiles and enzymes and hormones and many of the problems we can know with the blood only, because blood is the central stream that carry all nutritions, life and death also, then intoxicants also. So that's why the blood is important. And you will wonder that in that chapter of Sutrishthan means before Nidanistan, before Chikitsastan, one treatment is written there, that is Ashtavinshati Paniya Kalyanak. And that same Ashtavinshati Paniya Kalyanak is written in Unmad Chikitsa also, in Mahakalyanak Granth. So what for this Ashtavinshati 20? Ashtavinshati means the 28 drugs which can detox the blood. Okay? Since 1995, I am practicing mental health cases also. And this is the only, I am very humbly request to you, this is the only medicine I am using for detoxification of the blood. Only Siddha Jala of Ashtavinshati Paniya Kalyana. No plain water. Please take this water only. Ashtavinshati, you can see this Ashtavinshati Aushadhi from Vishala to Katuka. This is in Mahakalyana Granth, Unmad Chikitsa, Opcharak Samhita. You can easily get it. Okay. Then one more important thing. In this chapter, concluded by the Charaka, कि तस्य संरक्षितव्यम ही मन प्रलय हेतुतः. Pralay, crisis. In the crisis, to avoid the crisis of the mental problems or psychic problems, and tasya sanrakshitavyam, blood should be conserved purely. Purity of the blood should be conserved very nicely. Tasya, raktasya, and that blood, and that purity of the blood is to be conserved very nicely, very beautifully, very sincerely to avoid the every crisis of the mental problems. Tasya sanrakshitavyam hi mana pralaya hetuta. Pralaya means not pralaya. Pralaya means crisis. Okay? Critical stages. This is all by Manas. Now, one more important thing, ki in Ayurveda, our all treatments are based on Tridosh, Vat, Pitta, Kapha. Every drug is given the Prabhav and Rasaguna Virya Vipak, which are Vata aggravating or pacifying, Pitta aggravating or pacifying, or Kapha aggravating or pacifying, Vatagna or Vat Prakopak, Kapha Prakopak or Kaphagna. So we again very intelligently Charka in Vatkalakaliya Adhyay. Vatkalakaliya means the properties and physiological performance of the Vata. And all 16 kala, 16 physiological functions are described there. One of the important functions related to manas is a niyanta praneta cha manasa. What is regularizing? What is the controlling dosha for the mana? Niyanta controlling and praneta executing. Vata is the only executing and only controlling factor for the manas. So now we have the key. So Vatanuloman or Vata Sanshraman is very important for the every manas rog. Even Kapha's Unmad, even Kapha's Apashmar also. In every stages, Vata is important. And why Vata is important? Again, in chapters 11 of the Sutristan and first of the Saridistan, one very important quote is there. Ki the seat of mana Sparsanendriya Sarvendriya Vyapaka. This tactile sensory system is omnipresent in all the sensory systems. We taste after touching, we inhale, we smell after touching, we see after touching, and we hear after touching. So the touch sensation is very important. So the seat of manas is chetas samavahi, sparsanendriya cheto samavahi. This is written in Sutristan 11. Now we have the second key to treat the manas roga. We have to treat the sparsanendriya. We have to treat the skin. So abhyang, avgahan, swedan, alingan, these are the sparsanendriya. Even the mani mantra dharan is also to be touched on the skin. Alingan, Asirvad, Auguntan, these all for the sparsanendriya. And we can touch to the manas through touching, handshake, alingan. This all will give the very good feeling to the manas also. This will touch the manas. Asirvad. this will touch the manas also. So this is rightly said, the sparsanendriyam cheto samavai. So man is seated in sparsanendriya. That's why in one time man has beautifully performed all the sensory knowledge in one time. This is Kamalapatra Bhedan Nyaya. And all this knowledge, we are smelling some rose. This is in our memory. This is our hand memory also. We can feel the tender touch of the rose petals. We can see the beautiful red color or rose color in our eyes. At the same time, so all Indriya gets the knowledge because the man is seated in the Sparsanendriya. And this life science starts from the loop, that is Sparsa. This is in Tadhi tad Sparsa Vijnanam Dhariyat Hridayasritam. First sign of the life is start from the spars. So sparsanendriya, and first in Sushrut Saristan 4, Sushrut mentioned first started with the Sapta Tvacha, then Sapta Kala, then organism. This is embryogenesis. Sushrut is mentioning embryogenesis in Sushrut Saristan 4. Embryogenesis starts with the dermatological evolution. First with 7 layers of the tvacha, second with 7 layers of the kala, and third one is ashay and avyav. So organism started with the tvacha only. So first evolution, first organ introduced by evolved as tvacha. So this life starts with the sparsanendriya. So now we are having many procedures on the skin. They all will give the good relief in mental cases. It's my personal experience, and book is also prescribing this system. Vatanuloman. Second thing is Vat. That should be Anuloman. Only constipation may cause many mental problems. Only gut irregularities can cause the mental problems. Only dyspepsia or acid reflux can cause of the mental problems. So this is only all Vati problems. So this should be regulated. Basti is best treatment for the Vata. So many patients can be treated with the Basti. Basti means medicated Niro or Anuvasan Basti. This is also very good treatment for the mental cases. Then sleep. Many problems related with the mental problem, mentally sick patients are related with the insomnia or hypersomnia or irregular sleep or break sleep or many type of the sleep problems. And we are seeing many of the sedatives, tranquilizers, and sleeping pills are being used for the mental cases. Why the sleep is so important in these cases of the psychiatry? Because sleep is the result of 3 things. Visayebhyo nivartante. One thing means when the sensory system is withdrawn from gathering the informations. But now screen time and mobile time is so high. Indriya are every time busy to getting the information. So sleep is disturbed. Karmatmana klavanvita. And exercises, physical activities are less. So body is not tired for the sleeping. Come, go by car and come to the office, sit in the AC and go by car and go home. Nothing, no physical activity. Third one is yadatu manasik klante tada swapiti manavaha. Third one is very important. When mana should be rest, go into the rest. Class. The rest for the man is required for whole night at least to repair the wear and tear, daily wear and tear. Because the nidra is bhuta dhatri. Bhuta dhatri means mother of the living being. Because when the children are sleeping, mother will do the household work which are remaining very nicely. So if the person is sleeping, then sleep will repair the wear or tear. So unfortunately, these three conditions for the sleep are not fulfilled in nowadays. Indriya nivritti is not there. Shram of Sarir is not there. And Shram or Klam or Manas is not there. So unfortunately, sleep quality is poor. And you will wonder, this chapter is written by Sustrut in same chapter where embryogenesis is written. So for better embryogenesis, for the better evolution, the sleep 18 hours or 24 hours sleep for embryo is necessary. And for us, 7-8 hours sleep is still necessary. But unfortunately, people who are getting mentally sick are also having the history of irregular sleep habits. So this is the one important cause. And three important causes are there. And the Indriya Nivritti is not there. The Vyayam exercises is not there. And Man is totally engaged, 24 hours engaged. Even in sleep and dreams also, it is engaged. And the targets, this one, that one, that one. This is the problem. So no peace, no calm, no stability, no rest. So this is the one more problem. Now we can think about that there are three types of the patients: Hinsa, Rati, and Abhyarchan. Some are violent, some are Rati. Rati means Ichha, obsessions. Some are having obsessions, different kind of the obsessive compulsions. Rati. And third one is Abhyarchan, demanding every time, or false the spiritual practices. Jap, tap, home, niyam, bali, dharan, mang. These are the further 3, 4 times, 5 times snan, dhyan, jap, 2, 3 hours, 4 hours, a long weekend. They go into the jap. Abhyarchan. This third one these two patients, obsessive compulsions and aversion, are treatable. Dvau itarau sadhyam, hinsa asadhyam. The violent people are difficult to treat, but two others are very easy to treat. Why? Kamat krodham, krodhat kamam, काम क्रोध both with bhayam. Vishmapanam, Tarjanam, Bhayam. These are the treatment actually. In initial days of the psychiatry, there were the treatment of this type of the Bhaya, Tarjan, Vishmaran, Bhaya, ityadi. But now these are changed a little while. But still, these are the basic, these may be the basic for the treatment actually. So, finally, we are discussed about the what is manas, what is sattva, what is chetas, what is truth, and what are the false. And there are four constituents of the life. What is Sariram, Sattvam, Indriya, or Atma. Sattvam Atma Sariram cha. And Sarir in Sarirendriya Sattvatma Sanyogo Dhari Jivitam. Four constituents of the life. All these four constituents of the life need their own specific food. The food, drinks, and breathe are for body, sarir. But for indriya, indriyarth are needed for food. The subjects, sensory subjects, are the food of sensory system. Good hearing, good listening, good smell, good taste, and good touch, and good good seeing, good views. These are the treatment. If a person is having a good company, satam sevanam asatam parivarjana. This is the another key given by the Shastra. Practice a very good company and avoid the bad companies. Because these companion can generate your epigenetics. And very easily you can shift into the abuses. Only with the inspiration of bad company. And only with the good inspiration of good company, you can improve yourself. So company, this is written in 2 chapters. And lastly in Sariristha, 10 times and 1 full chapter Indriyopakramana is written there. This good company, good reading, good hearing, good listening, good smell is the good food for the Indriya. Like food, drinks, and breathe are the food for the body. And what is for the manas? Manan, Chintan. Chintyanam chati chintanad is the bad food for the man. What is considerable, you are overthinking anything, this is bad for the man. And achintyanam cha chintanat, what is not considerable, you are unnecessarily thinking of that. This is also bad. So Chintan, Manan, Vicharan, Uha, Dheya and Sankalpa are the food of Manas. Good reading, good thoughts, good company. This is the food for the Manas. And for Atma, Atma is also need food. For Atma, Sanyam is the best food for the Atma. Control, Indriya Sanyam, Mana Sanyam, Mano Nigraha is the good food for the Atma. And Dhyan, Bhajan, Jap, Tap, Shuddhi, and purity. These are the food for the Atma. So every ingredient of the life needs their own specific food and good food. That's why Ahara Shuddhau, Sattva Shuddhau, Dhruva Smriti. So this is the last and final word from Charak, that all four ingredients need pleasure and welfare. This is Sukhayu and Hitayu. Sukhayu for your individual and Hitayu for all human beings, all living beings. This is Hitayu. Anyone alone cannot be happy, cannot be satisfied and trapt when others are hungry, when others are sad, when others are in grief. So it is to be delivered. Happiness is to be created, happiness to be delivered to others. And that's why in chapter 30th of this Sutristan, one Vidya Vranganana, Ahinsha Praninam Pranavardhanam, Brahmacharyam Ayananam, and Ayurveda Amritanam. Brahmacharyam Ayananam, your lifestyle, your good code and conduct. This will lead the happiness, this will create the happiness in all living beings. So now I am summing up my treatment. There are 3 stages of the manas, and every part, every section of the manas is having a specific treatment in our books. Man is Vata Niyantrit, is regulated by Vata. So for Man, good sleep and good Vata Nigraha, Vata Prashaman, specification of the Vata. Most of the Ayurvedic recipes for the mental problems are made by ghee, Grita. So Grita is a Sreshta Vata Nigrahakar. Kalyana Grit, Dakshadi Grit, and these Panchagavya Grit. This is Grita. Grita is the best treatment for the Manas Roga. But I don't see anyone is using Grita in my conservative system of the psychiatric treatment. But this is the treatment, and we are getting the good results. Grita. Because it is Vata Nigraha, Agni Vartak, Vata Vartak, and best food, which is the basis for the subtilization of the food. Subtlest Sattva is Grita. Grita is the essence of the quintals of the grass. Grita is the essence of the quintals of the herbs. Just few grams. This is Sattva. So Sattva is Grita, and Grita we are having in abundance. So Grita is the treatment for this Manas Rog. Abhyang is the treatment for the Manas Rog. Avgahan, Tabbat is the good treatment for the Manas Rog with Avgahan with Vatanasak Dravya, decoction of the Vatanasak Dravya, Dashmul, Nirgundi. This is very good. Avgahan. Simple. Siro, Dhara, Siro Pichu, Siro Abhyang, Nashya. These are the Vatasaman. These are the very good treatment for this Manas Rog. Karna Pichut, Nabhi Purana, Nasha Purana, Basti are the good treatment for the Vata. Good treatment for the Manas Rog also. In one rehabilitation center at Melbourne, I fortunately had one opportunity to get this WHO fellowship in mental health in 1995. And I worked there in some rehabilitation center. And Australia is a very good open country. And my professor was Indian, fortunately. He was understanding very well the importance of Ayurveda and principles of Ayurveda and this Ayurvedic herbs. So we have used the Grita there in all forms, in form of Nashya, in Basti, in Siro, Abhyanga, and in Abhyanga, in all forms, in Pana also. So we with 24 Pravicharana. And it bear very good results. In very severe cases even. Otherwise, in my OPD practice, I don't take the severe problems generally, but most of the 80% cases are having primary mental problems. They can be treated very easily, and severe patients, you are having a national institute, and your institute may be supplement this type of the treatment there also in your cases, but this treatment is very effective. Then mental patients should not be allowed to have a bed for 24 hours. No, they should be worked in the hospital according to their specialization or according to their mental skills or according to their age or also. I have seen in ISA Foundation, I visited a hospital, but hospital beds were empty. Where are these patients? These patients are working in farm. The patient should not be lie down for 24 hours with sleeping pills. No, this is not good. Patient should be work hard. Okay. Then blood detoxification. Very important factor is you please take documentation, evidences from blood investigations. There may not be very much high detoxifications but your National Institute may detect every intoxicated cell of the blood. You can investigate that. And you treat with Ashtavinshati Pani Kalyanak or any of the Rakta Shodhak Dravya, like Manjishta only. like Kutki only, like Sariva only. It is very easy. Some Medhya Rasayana are also important in few cases, very few cases. Brahmi, Manduk, Parni, Madhuyashti, at least. Vacha, these are very important, but in very few cases. But unfortunately, now we are in practice of the patent drugs. Patent drugs does not give us the logic between the cause and effect. So, better for understanding the students, the cause and effect and the role of drug should be clarified. And these generic medicines mentioned in Shastra are having their own phalashruti, having their own Dravya Guna Karma Rasa Vedi Vipak system. They can be explained better in better way how they can be a treatment. Atattva Vinivesh. Atattva Vinivesh is very shortly, very in 4-5 lines only given. But these 4-5 lines are very important. Malin ahar should be totally avoided. But one more important thing, unfortunately, I forget about this. Sattva, Raja and Tama. Triguna or Tridor. Do those. But Sattva is to be prevailed and Tamas and Raja should be depreciated or pacified. And Susrut says for our interest कि सत्वम आकाश बहुलम तमो बहुला पृथ्वी और रजो बहुला वायु. Earthly matters can increase heavy matters, reused, reheated, preserved. Many metals, many minerals can increase the tamas. And many vayu prakopak ahar can aggravate the rajas. And sattva is akar. Space conservation is required. Space in brain, no congestion. If the congestion of brain, it means sattva is not there. Is the foggy mind, sattva is not there. To preserve the space between every cell, not in brain only. A required space is the space is required to dance the cell for the life dance. So sattva is that space. And space is occupied with some waste material. That is tamas, that is parthiv, that is heavy, that is non-excretable. So this concept is very important for understanding the Manas Roga. And fortunately, you are having the integrated system of the teaching. So what Ayurveda can contribute to the world psychiatry is their own detailing of the cause and effect list and this system or pathogenesis. Manas is the only factor which can have, which is influenced by social, financial, emotional, and many psychosomatic and many somatic also, many trauma, many seasons also, even full moon and full heat can aggravate influence the manas. So we are ever anchored by the cosmos. So every factor in the cosmic outer that will influence our dosha. So these concepts are very important. If you find it useful, please tell to your faculty and your students and try to develop this model. And definitely it will be very beneficial to the psychiatry, where we are having a very great problem. We are not able to control only with mood elevators, tranquilizers, and sedatives. This is not the treatment, actually, only treatment. This can be a very crisis management, but this cannot be a treatment. Withdrawal of these drugs is a very difficult process. Many of the cases I see that cases are really diseased by the over medication or irregular medication, or without any prescription, they are getting medication. Doctors are not doing any harm. I know they are my colleagues and they are very well versed. But what about the patients? They are taking these medicine out from the drug stores and they are having very serious problems. So please get it. You conclude it in your time. I am in prescribing, I am delivering in a very haphazard way. You are very good institute and you please keep it documentation and use this concept for your treatment, for enrichment of the psychiatry. Thank you very much. I am very much grateful to Dr. Umesh, who introduced me to NEMHANS, and Dr. Kishore and Dr. Kavya, who has introduced me here. Dr. Kishore, you are great, and I think you are very good disciple of my student, Dr. G.S. Acharya, and he was a very good. I request you to pay him a great tribute with your knowledge of Ayurveda. Thank you very much.
Thank you, sir. Thank you very much for thoughtfully explaining the basic principles of Manovijnana and also giving very deep insights into the etiology, pathogenesis, and the treatment of Manovikaras. Thank you, sir. Now we will have some questions. So audience, please, you can put your questions in the chat box. We have some questions, sir. I'll just read it out. So the first question is, what is your understanding of Ashtavibhramas and its management?
Yeah. Sorry, I could not explain you Ashtavibhrama. The mana, buddhi, sangya, jnana, chesta, achar, sil, vibhakti, vibram. And actually, these Ashtavibhrama are a concluding statement by the Acharya which covers all your DSM. All DSM. You section your DSM in 8, you can easily section your DSM in 8 sections. Some of them are cognition problems, some are behavior problems, some are personality problems, some are memory problems, some are sensory problems, some are likings or dislikings problem. So basically, these 8 Vibrama are covering all these mental problems. All these mental problems. But unfortunately, I forget that point. But Ashta Vibrama, what you call Chesta Vibrama. Chesta, Ahara Chesta, and Sayana Chesta, and Vyayama Chesta. These all are Chesta. Okay. This bulimia, this food, food problems, with Vyayam problems, with physical problems, with gait problems, with overactions, with seizures. These all are Seshta Vipram. Some are Sila Vipram. These are loss of discipline in every life field, every gap of the life. With mother and father, with wife and husband, with son and daughter, with society, with friends, with boss, with juniors, with anyone. This is the problem. And he cannot accommodate anyone. This is the Sila Vipram. Seal. Where should be obedient, he is not obedient. Arrogance, hesitation. This is Sila Vipram. Where is Sangya Vipram? His false sensations. What is not there, he is seeing. What is not there, he is hearing. What is not there, he is gustation. And extreme, excessive, that is also Sangya Vibram. So Indriya Vibram and Sangya Vibram is same thing. And Achar Vibram, उठना बैठना चलना फिरना रोना गाना खाना पीना सब आचार है. कपड़े पहनना आचार है ना. These all are defective in a mental case. This is Achar Vibram. And substance abuses. This is also Achar Vibram. What to eat, when to eat, where to eat. Huh? This is also Achar Vibram. How to eat, how much to eat. This is all Achar Vibram. So 8 Vibrama are a one broad area where all the mental problems are covered. I think so. One of my students has did this PhD on this 8 Vibrama. She covered all parts of the DSM-4 at that time, DSM-4 in 8 Vibrama. Okay.
Thank you, sir. The next question is, Dushta Rakta causing mental illness, then Rakta Mokshana, like leech therapy, is beneficial in psychiatric conditions, including schizophrenia. So, from the reference of Sushruta Sharirasthana for Unmada, Shanka, Apanga, Keshanaka types,
Yes.
question for Rakta Mokshana.
Yes. In that case, Rakta Mokshana Siraveda is also a treatment. Because Charak also mentioned Rakte Panite Hitamannapan, Rakta Apanayan, Rakta Mokshana, by Jaloka, by String, by Elabu, by Siraved, by venous puncture, anyone. The intoxicants can be released immediately, but important thing is not to get the cycle of the Rakta Tushti. Okay, you should avoid the patient. What is the patient is taking some substances which are toxifying the blood. Okay, that is also important. Once it is toxicated, you remove, but again it will be there. So intoxicants should be avoided, totally restricted.
Thank you, sir. So the next question is, please elaborate on the concept of Atattva Abhinivesha.
Concept of Atattva Abhinivesh, Atattva means what is not there. Abhinivesh means involvement, attachment. The all fallacies, fantasies are Atattva. All hypotheses or illusions, delusions are Atattva. Okay? Or hallucinations are Atattva. Tattva means substantial. Where is no substance, the patient is involved and attached and badly attached and invested his whole life into what is not there. Okay. So Atattva Abhinivesh is the one word which cover all the mental problems. That's why Acharya said, Atattva Abhinivesha ek eva mahagada. Only one disease can cover all the diseases. Even in somatic diseases, jwara, many Atattva will be there. Fever, many illusions will be there. In Rakta Pitta, in bleeding, many illusions may be there. In Gulma, many illusions may be there. So, Atattva will be there in every psychic condition and somatic condition and psychosomatic conditions. Okay?
Thank you, sir. So the next question is there any difference in approach to unipolar and bipolar depression according to Ayurveda?
Very, very different. Everyone is bipolar. Only God is one unipolar. Okay? Everyone has bipolar. Okay? But in that sense, we have to balance that. What is a person is a divided personality. Or one person is different and other person is different. For this time is different and that time is different. So this posing, this masking, this behavior, which turns arrogant or which turns violent, all of a sudden. So that is caused by some rajas or tamas, not with sattva. So at that stage, the person has a less space in the brain to accommodate the adversities. In every life circumstances, we face every time adversities. But to face the adversity, he has to make the space in their mind to accommodate. Okay? So that is because of tamas and rajas. And what is there really? We have to diagnose first and then to remove with Ayurvedic medication. I said tamas is Prithvi Bahul and rajas is Vat Bahul. Sometimes it's Pitta Bahul also. Okay?
Thank you, sir. So the next question, the participant has asked, please summarize approach towards patient with mental illness with 8 to 10 salient points.
Okay. First, you decide what status of the patient, of mental status is. He is Sattvic, Rajasic, and Tamas. There are 16 personalities in Ayurveda. 3 तामसिक, 6 राजसिक and 7 जो है तामसिक, सात्विक. 16 personalities. You don't get only Hamilton scale. You assess the patient with the Ayurvedic status of the mental health. What particular dosa is there? First thing. Second thing, then you try to get vata is increased or blood is intoxicated or nidra is sufficient or sleep is good, ahar is good. These should be your questions. If you are getting a right information about the blood intoxication or vata aggravation or ahar diet is not proper or sleep is not proper, then you treat like that only. If that is there, you please start with Abhyanga, Svedana, Snehana and Abhyantar Snehana. Then with Basti, then with Nashya, then with Sirodhara, then with Siropichu. So this is the process of the entering into the patient. Don't directly diagnose the patient with this psychiatric stage is there. No, first what is saved in the patient. First you diagnose what is saved, what is wrong, and what is saved. What is saved that you should conserve, and what is unsaved that you should start treating. Okay.
Thank you, sir. So the last question, can we say Unmada name as psychosis? So how to define Unmada in terms of Ashtavibhrama?
Every Ashtavibhram can lead to Unmada. Vibhram. Brahm means confusion. Brahm means false. Brahm means not as per the normalcy. Vibram means very special. Vibram means viparita. Viparita Brahm. Vibram means Vishesh, specific degenerative changes or specific type of the illusion or confusion or something ill knowledge. So every Unmad patient have a particular 1, 2 or all 8 Vibrama. Okay. But Unmada patient is violent or obsessive or in Abhyarchan. You categorize that. Then Vatik, Patik and Shlesmik is Swalpa Asapadda Vachanatvam, very less talkative, and whenever he talks, very irrelevant talk, he is quarreling, he is violent, when he is very aggressive, very active, hyperactive, this is Vati. So there are the symptoms given for the Vatik, Patik and Shlesmik Unmad, and Hinsa, Rati and Abhyarchan also, and all Vibram also. So we have to decide what is the aggravating dose, what is the main dose in this. And first you don't see Unmad directly. First you specify the dose. First you dealing the dosha with the Unmad. And then you can easily treat the Unmad patient.
So here we have come to the end of the session now.
Thank you.
For patiently answering the questions. So I would now request Dr. Umesh sir to deliver the vote of thanks.
Thank you, sir. It was a very knowledgeable session, and in spite of your busy schedule, you agreed. And initially, we asked you for Ayurveda Day, and you are the one who specifically told that I think it would be better if we organize the same talk on the Mental Health Day, and we, on the behalf of our institute, our department, we wholeheartedly thank you for agreeing, sir, and for especially your talk was like nourishing to our mind, sir. So I think your knowledge nourished our mind today. It is our manas got nourished, sir. So we wholeheartedly thank you on the behalf of our institute and the department, sir. So next, I would like to thank our HOD, our faculties, and our staff and students of our department who are behind this function. And also, I thank our director and our institute for supporting and permit us to conduct this program on the occasion of this World Mental Health Day. And also, lastly, I thank all the participants joined and attended this guest talk. And I think it has nourished all their minds through the knowledge that I have imparted to us, sir. So thank you very much, sir.
Thank you. Thank you, Umesh. If it is
you, sir.
useful, a iota of the knowledge it can deliver, that I will be very happy to segregate with you. Okay, thank you,
Thank
Umesh.
you, sir.
Tell me
Definitely, sir.
rightly.
It has helped us a lot, sir. Thank you very much, sir.
Okay. Thank you, all participants. Thank you for patient hearing. Thank you.
Thank you, sir.